So it's just me today, but we do have Miranda on video. But I'll start by saying, yes, I'm Christine Porcaro. I'm with the Healthy Roots Collaborative. Healthy Roots is a food systems program that came out of a number of community organizing efforts to support diversified agriculture in Franklin and Grand Isle counties. Our work to strengthen the local food system of Northwest Vermont is focused on three primary program areas: farm and food business support and market access facilitation, leaning and food access, and farm to school. Healthy Roots hyper-regional programming allows us to tailor our approach to our community needs that works towards improving food access and education around local food, while also working towards eliminating transportation barriers for our farmers and our eaters in our region. Today, we are lucky enough to share a little bit about an amazing partnership we have with Northern Tier Center for Health, a federally qualified primary care provider in Franklin and Grand Isle counties. This partnership has helped shape our programming over the years and how people can access local food in our region. Miranda Henry, the Notch Community Service Manager, wasn't able to be here to share our story, but we've put together a short video so you can see more about this really awesome relationship between healthcare and local food.
Hi, I'm Miranda Henry with Northern Tier Center for Health, also known as Notch, and I'm here today at our Richford Health Center campus, which is home to Main Street Market, the state's only nonprofit grocery store operated by a federally qualified health center. Notch is a federally qualified health center with service locations around Franklin and Grand Isle counties. We have 8 medical centers, 4 pharmacies, 2 dental clinics, a nonprofit thrift shop, a partner project, and a nonprofit grocery store. Back in 2020, Richford was facing a dilemma in the community. The store's only grocery store, which was access to fresh produce and other whole food items, was going to be closing. Associated Grocers of New England, also known as AG New England, was getting ready to close the Vista Mart, which they were operating at the time, and there was a problem. Where were people going to get food in town? So Notch decided to step in. They brought together a group of stakeholders at the state, local, and regional level to come up with a long-range food access strategy for the town of Richford. And that led to Notch taking over the Main Street Market.
Preserving access to nutritious food for this vulnerable community is a top priority of Notch's Main Street Market social grocery project. Another element of the social grocery entails supporting local food pathways. Connecting with local food growers has served us in our mission to provide area residents with nutritious, seasonal produce they know and love while containing market costs to make local healthy foods as accessible as possible on all budgets. Geographically speaking for the social grocery, however, this work has been easier said than done. Richford is situated right on the border of Canada. It is not en route for many food distributors. Then there's the issue of connecting our smaller local farmers to a transportation network. Getting food from point A to B and sometimes to point C is riddled with many practical and logistical challenges in a rural region such as Franklin and Grand Isle counties. Distance between locations, resource limitations for partners in our organization, and the cost of moving food under these conditions created roadblocks for local food distribution pathways. This is where Healthy Roots enters the picture.
The Healthy Roots Gleaning Program regularly delivered gleaned produce to wicker baskets located at Notch sites throughout the region. A lot of the time, the baskets would be empty by the time we arrived at the clinics, but on the times when there was food left over, it was because it had not fared well in the temperature of the waiting room. We talked a lot about the sad lettuce we'd find when we came to restock the baskets. We were lucky enough to be awarded an EDA Disaster Resilience Grant through the Northwest Regional Planning Commission, which allowed us to purchase mini fridges for all these sites. This allowed for the produce we dropped off to not sit at room temperature, and also paved the way for us to purchase local produce to stock these fridges. Since we were already gleaning, purchasing, and picking up from farms, it became the next logical solution for Healthy Roots to be the transportation connection between local farms and the Main Street Market in Richford. Because of our existing relationships and established distribution route, we were able to overcome a roadblock of local food making its way to Richford.
Through collaboration on the gleaning program at the clinic sites and our mutual involvement in food access and food as medicine work, including participation in the Vermont Farm to Plate-led healthcare and CSA community of practice, and Notch's involvement in the Food Access and Healthcare Consortium, the Northwest Pharmacy CSA was born. Notch and Healthy Roots operated a small pilot program of the pharmacy back in 2022, which included 10 Notch patients local to Richford. This year marks our third year running the Northwest Pharmacy CSA, and we have grown to serve patients at all 8 of Notch's healthcare centers, with 35 enrollees at any given time during the CSA season.
Much like the mini fridges, this allowed us to increase our local sourcing. Over the past 3 years, we have sourced local food from 12 different farms to support this programming. This is around $30,000 in local purchasing that goes directly to feeding people in our community. We were able to highlight many of these producers in our Franklin County Farm and Food Guide, which is a regional map of local farmers, food producers, markets, restaurants, and farmers markets. We were able to include the Main Street Market for its sourcing of local products, highlighting the store and the surrounding local producers.
The foundation laid out by the collaborative work of Notch and Healthy Roots has paved the way for further partnership opportunities. With support from both our organizations, the Sheldon Methodist Food Shelf applied for and was granted funding in 2024 to support a medically tailored pantry and meal kit program. Through partnering up, we were able to create another food as medicine program. Now we're able to reach even more nutritionally vulnerable people with chronic health conditions in Franklin and Grand Isle counties. Notch and Healthy Roots have been invited to the table of other community partners, including Vermont Department of Health, to look at how our collaborative model can be applied to different settings.
Healthy Roots was housed at the Northwest Regional Planning Commission until the summer of 2024. In 2023, we had been renovating a warehouse space donated by the Abbey Group in Sheldon in partnership with Feeding Champlain Valley. It was through that process that we were able to identify the complementary aspects of our work that we were doing in the region. In July of 2024, Healthy Roots Collaborative became a program of Feeding Champlain Valley. One of the first collaborative projects after this transition has been taking over the management of the Richford Food Shelf, which had been a role the Notch had played for many years. We can use our access to food, transportation, and storage to continue to support the Richford community.
All this systemic and programmatic collaboration has a human endpoint. We have seen an increase in food security as well as produce consumption among participants in our Food as Medicine programs. Through the Gleaning Program partnership, thousands of pounds of free local produce is distributed across the region each year. Our work supports the local food economy. Last year alone, nearly $16,000 of our program funding went to support our local farm partners. And that number keeps growing. This year, we currently work with 8 local farms, and they are fabulous folks to work with. Looking beyond the numbers, there's a bigger impact of opening up the channels to fresh local food through our work. I'd like to conclude by sharing a couple of quotes from the Northwest Pharmacy CSA.
Always said that the most important word in the Healthy Roots Collaborative name is the word collaborative, because the greatest work we have ever done has been in partnership with other people, businesses, and organizations. I hope that this can be a powerful example of what is possible when people come together with shared purpose and vision for our small but mighty communities.